Hi, Dr. Harrison here, and today I wanted to discuss a very important part of my practice, and that is the area of functional medicine. Some people have heard that term before, but for those of you who haven't, functional medicine refers to a patient-centered approach to evaluating that individual for whatever condition they have going on, and really looking deep to finding the root cause of what may have broken down in the body, what processes have been interrupted that are causing the body to manifest these symptoms. You know, why were they fine one day and now they're not fine all of a sudden? Well, there's always a reason, and if we do a good enough job investigatively, we're going to find out what's driving that problem in this patient. One of the biggest culprits we see is inflammation at the cellular level. In fact, inflammation at the cellular level is probably the #1 cause of most of these autoimmune problems which are plaguing the nation and around the globe right now. So from hypothyroid to type 2 diabetes to cardiovascular disease, celiac disease, autism, all these autoimmune responses are driven by inflammation at the cellular level. We're talking about every cell membrane at every level. So doing this history is vitally important to find out, well, what's driving that inflammation? Is it bad diet? Are they toxic? Have they been exposed to toxins, maybe Lyme disease, maybe mold or a biotoxin exposure? All of us are exposed to heavy metals and different, metals and products. You've got mercury and flu shots. We've got exposure just from the air we breathe, the water that we drink. Fine example, more recently in the news would be what we saw happening up in Flint, lead in the water. So there are different ways that we can be exposed to all these toxins, and part of our history taking is to find out, well, where did these exposures occur? How can we eliminate what's being brought into the body to try to downregulate that inflammation? And then we can really develop a plan of attack on how to not only drive the inflammation down. Sometimes we'll use supplements. Diet can be a big part of it. Too much sugar drives inflammation. The wrong types of fats in the diet will drive inflammation. So we're going to look at all of those things in squelching down that inflammation, because if we can get that cell membrane working properly, that's where the magic occurs. That's how the body heals itself. That's how it gets its nutrients. It's how it detoxes, is at the cellular level. So when we do our detoxification programs, we're focused on detoxing. What we consider to be true cellular detox, or true detoxification, occurs at that cellular level. So that's what our focus is in the office. If we can fix the cells, then we can get you well. So I hope you found this information very useful. If you're suffering with an autoimmune condition, you've got symptomatology, or if you have any questions at all, please feel free to call the office anytime, and we can set up this consultation. Our initial visit takes usually about an hour to an hour and a half, and we go through some in-office testing. Again, we go through those questionnaires, and let's sit down and try to figure out what's going on so that we can help you with what you have been struggling with. I can tell you the patients that we coach one-on-one in our nutritional programs doing the functional medicine tend to do very, very well. Some of them suffering with weight loss resistance, some of them hypothyroid, type 2 diabetes, cardiovascular. We're well versed in all these areas, and we are just excited to help you get your life back on track. So again, any questions, call the office. I hope this helps, and we hope to see you soon.